Welcome to the Direction of Economy with Sarah. I'm your host, Sarah Sultan Sayar, and you're watching Where Economic Goes Beyond Numbers. Today, we are talking about beauty, but also about confidence, perception, and choices. Because economy, it's not only about numbers, it's about what people choose to invest in. Today's guest is a very well-known plastic surgeon from Egypt and an internationally recognized trainer. He works with patients and the doctors from the Middle East and Europe, and he is known for his modern techniques like rim coats and ionic liposculpture. I think today I'm a little bit nervous because I'm sitting in front of someone who can change faces. Dr. Rami El-Anani. Welcome to Istanbul and welcome to my program.
First of all, thank you so much having me here. Again, it's really great opportunity being among all of you. You, sir, you are like icon in the beauty. So when discussing things related to the beauty, it brings me also trying to describe me from deep of inside, other than science even. So especially this topic that we're gonna express today, it will be really very valuable for the all who can watch us. So please, being there, a lot of things we're gonna be, so we can start whatever you want.
It's my pleasure. Doctor, before we start, but to be honest, do I need something?
Oh, it's a tricky one. Look, first of all, as I mentioned before, you are, of course, there is no need. You are already pretty. But if you are, take it from me, this is my rule in my work. If we decide something, it's specifically gonna be for you, not for others. Because it's not like, automation. I say, Sarah, you will want this. It means anybody want to repeat it like Sarah. We want to do whatever Sarah wants. So it's really clear. If we decide together something, because you're already pretty, if we add something like value, for now, we can say something. It will not going to be major transformation for anything. But to be concluding, you are not in need. But if we are insisting for some caring, we can discuss it later. Private way, I don't know.
Okay. I was waiting for this answer. Now we are safe. I can say
Okay,
this.
yes, sure.
First of all, how are you today? I didn't ask this.
I'm really great, doing great. You have a really marvelous country. So I'm just spending some days before the episode that was already pre-planned. Nowadays, it's my target time to deliver that knowledge. I was really want all the time to be delivered globally. I tried all the time to deliver this knowledge. But today we're going to be in a simpler way because all the time when I'm trying to propagate this knowledge, it was in professional way among doctors. But now we delivered for the whole population. So hopefully all who are watching us to can understand, we will simplify everything in our talk today.
Can you introduce yourself briefly to our audience?
Yes, of course I can, but it's really hard, but to be shortly, I'm Dr. Rami El-Anani. I'm a consultant in plastic surgery and the aesthetic field with other surgical or non-surgical ways. I'm also not just practicing as a clinical doctor, of course, but also I'm an international trainer, recognized and licensed one over the globe for training for the modern concept in surgery and non-surgical aesthetics way. So simply, I'm a doctor and trainer at the same time for doctors.
I'm really happy to have you here.
Thank you so much.
Let's start with this. You're working internationally and training doctors around the world.
Yeah.
How would you describe your position today?
Honestly, if I thinking by this way, I will say just one word. How to be a doctor and at the same time responsibility. This is a responsibility. It's not the thing that you are more famous doctor, you are here and there. No, the things that come by this way that brings you in a position of responsibility. The responsibility when you are teaching other doctors, you are not just delivering knowledge for a patient that they already facing you in your clinic and your consultations, but you are facing a lot of patients over the globe because of all these doctors you are already training. So it's really responsibility because one word you say for one doctor, it will propagate So it's not just as a doctor who is, it's of course, it's a very big responsibility to be a doctor with your patient, but let's multiply these things like 100 times. It means that you are with a bigger scales to broadcast this knowledge. So the responsibility, which really comes to my mind when firstly you're asking question, what's your position? This is really brings me all the time thinking responsibility.
What makes your work different from others?
Okay, anybody has his own print. This is first of all, as a general speaking, not just in medicine. You have your own print, I have my own print. It's different, your personality, your way of thinking, everything. And of course, there is schools that a lot of doctors follow some schools and other doctors follows other schools in the pattern of thinking. But what's really brings me to think, okay, I take the medicine at all and the plastic surgery science in my consideration all the time. It's the base that we will start to talk after. What brings me different a little maybe because I don't do just, Sarah, not just a fixed technique. It's like more or less, I even try to teach these things, not just for doctors, even for, the clients and patients that came for consultation in my clinic. I try also to deliver what I got to say now. Firstly, it's not just like templates and we'll do this. Like, I don't like this way. Of course, we'll discuss later what's really brings this not okay at all. But firstly, I told the patient, the analysis. We go firstly to know the structure of your own body, which is different from the one who's sitting or standing beside you. So all the human are different from the structure. Of course, there is fixed things, but the print as your eye, as your finger, you have your own print on the body structure, even for distribution of your fat, not equal to others. The skin pattern, if it's like in the scale of what, but you are different. We were discussing before the episode, you are different than your mother. Yes, we were discussing this point. So we'll first go to analysis, how the structure is of your body. Then we'll go to how to expect the result and the procedure. Then it means that it's not like formulas that we are follow. No, we are dealing in my concept in any patient, any client, that a unique case with a unique story, with a unique history, with a unique expectations, and we try to deliver all this language. It's a customized one. That's why when you ask me what's the difference, I don't say that I'm the only one, but this is the brings any doctor to be different, to be with the reality. You are dealing with the reality among all patients. When I'm facing you, I'm trying, if you come to my clinic for the consultation, as if you are my first and last patient. Take it like this. It's a unique one. The unique, so we go through the analysis, then the decision, the procedure, the expectation. And you know what's also very important when you ask me about what's really brings you different, that you are really mean to me after the procedure more than before. Before, okay, it's very important that you're seeking my advice, but after procedure, you are my own patient. So again, the follow-up after the procedure, it's a key point. It's not less important than the procedure itself. So I think this is a little bit conclude what's my way of thinking and what brings me really to put myself in this position.
Wow, you're not just a doctor, you are also building
Philosophers.
a global name.
More or less, yes. Thank you so much. Yes, of course. The global, I think nowadays, there's no borders. The effectiveness, the efficacy, break all the borders. How's now when you are thinking in your country and anyone who's thinking in his country, I want something really important to me. We are dealing with our bodies, with our face. It's not so much for you to search where you can improve your own. You try sometimes to travel, to buy something, clothes, whatever accessories, and to enjoy vacation. So you are thinking about traveling because of these very small things. Okay, it's very nice, but we are dealing with our bodies and our face. So if you are just thinking to travel, of course, it's very important. So that brings me when you're feeling global, of course, we can see in my clinic all the nationalities from all continents. That's why, not because I'm the only one or the best one, no, but they are searching. They find my concepts, they find my matching the logic and their own concept in their minds. So that's why when they came to my clinic, even in the online consultation, even in the physical consultation, we try to merge our way of thinking. I have the science and the expectations, and you have your own imagination. So we have to have each other in a meeting points. That's why all the consultation I'm telling the patient about, it's not just a consultation. I have the knowledge, I have my way of thinking, and you have your way of thinking. Okay, to be honest, I have to deliver it in a very good way and a simple way, as we are trying to discuss today, in order to bring you like in my shoes. That's it. We are identical. It means like this. So then, if we have this chemistry and the delivering of knowledge, because it's really challenging, you try to deliver a very scientific and honest informations and data. But if the marketing, and maybe we'll discuss later, I don't know, if the marketing or the social media have so much impact in the mind of the clients, so it will be like battle inside the consultation, because I tried to prove the science and what is the real expectations, not what is really going here and there. So I tried to teach her or him first about the science, and okay, I don't want her to bring to the science. No, you never do this. No, I'm trying to deliver what's real, what's the real information, what's the real medicine for him in a very simpler way, and try to reach her mind, but not to go completely to her mind, because sometimes it's like brainwash what's happening in the marketing. So I don't dive with her until her limit. But at the end, we want to find the matching point in between. This is a very successful consultation if you reach at the end what is going on at the end, that to be in balanced decision, and you are accepting, and her is accepting, and he is accepting. Means a lot for the whole story and the procedure. You will not succeed in the procedure if you don't have a success consultation, that everything had been delivered to the client or the patient, and he understanding and accepting maybe the side effects more than whatever the things that is going to be better after this procedure. Then, I'm with you.
Today, people don't
I
only.
know I speak too much, but still, I want to deliver my things there. I don't know it was or not, but
No, it's okay, dear. Today, people don't only want to look good. Also, they want to feel strong, And do you see beauty as an investment?
Okay, it's a very deep question, by the way, because we can take the investment from different aspects. Is it investment for doctor, or even investment for the clients and the patient, or even investment globally for even the level of countries and the society? It can invest, it's surprisingly, it can invest in any pattern or aspect of that. This question have a really very big base that I will take it right now. First of all, for doctors, of course, it's an investment in him, because in his work, because now the plastic surgery and cosmetology, it can affect all the aspects of life of any client. So, and new techniques and new procedures and new products and new devices all are sharing to reach at the end better lifestyle for the patient, how he looks, how he live, his body, the confidence, a lot of things. So the investment in this part has propagated and increased. But anything with a positive thing has the other backdoors for that. So how we can manipulate. The other thing is the investment for the client or the patient himself. Because when you are invest yourself in how to you looks good and how you looks healthy in a better way, your face, your body, of course it will affect firstly psychological issues, social life, and all of that can affect also his work, believe or not, or accept or not, but the shape of you as a body and the face course it affects your lifestyle and even your work and even of course your financial state. Everything has it's affecting and make it like a mirror, having the picture that comes from in the mirror. If you are really caring about these parts, of course it can has an impact in your investment. You are investing in a lot of things. You are investment even in your mind when you are studying. You are investing in your time. So you are investing in your how you looks good, how you looks better, how you are really want to live, and the time when it goes like the clock is one, you want to withstand all the negatives that affect your body and your face. All this is a medicine, so it can make bigger of course investment for the client itself, and both of this doctor and clients, it affect the society itself as an economy, as an investment, because it's really industry, but with a medical and aesthetic background, ethical background and medical background. Of course, it's related to the economy at the end. And we are seeing here, even in Turkey, it's a huge investment related to different topics like hair transplant. It's like, you know, all the time you can see what is happening all the time. Even and you see in any airports, you see a lot that's related with the print of Turkish hair transplantation. It's unique and it's very big industry. So it can affect the investment and even the economy of the country and society itself. That's what I want to say.
When patients come to you, what are they looking for?
Okay. Shortly, it's like almost like two groups. Maybe small groups also have, but this is the two major groups. Firstly, the group that's I don't really like that way, so that's why I'm trying to teach them during this part of group. When they seeking consultation, they came to me, you know, Sarah, as I mentioned in the beginning, I want the lips of Sarah, maybe after injection of lips, maybe if we try to ask me to inject my lips and then I inject your lips. So the first group of clients or patients came, I want Sarah's lips. No, baby, it's not that way. You have your own ratios, your proportions. What suits, sir, it doesn't mean a must that suits others. We are not copies. We're not want to look artificial. This is the really cutting edge. This is in the middle that you have all the time to be balanced. Balanced. So whenever when they talked to me and came asking for something to do, I told him at that time, no, you came for a next step. There is a previous one, you skip it. You don't mention it. We have firstly goes to analysis of the structure. I told you two things. Analysis of the structure as the first part, then we took the decision about the result and expectations. So firstly, I don't like the group that comes asking for something to do. They comes firstly to asking the doctors. I feel that okay, this part in my body I don't like. Then I will tell her how to correct, how is better for you. Don't come to me. I want to do tummy tuck. Of course, maybe, but maybe not. So don't ask the second group that I really like. As I ask you, that we want all from such respectable TV program to always tell, please ask about the problem, not tell the doctor, I want this procedure, because what suits you, it doesn't mean that suits other. I told you, it's a customized formula. It's not a repetitive formula. That's it.
Do you think appearance affects opportunities in life?
Yes. As simply we are already speak about, but we can dive into the details. Let's imagine you are a very good one. You are having a very nice mind. You have a lot of skills that's related for TV. But if you are not in a good shape, in a good proportions, and you are caring of your things, your face, do you feel that the opportunity will not change between both who are having all things but differ for the caring in the body and the face? Of course, the opportunity. We are human. We love the beauty. We love caring. We love to be balanced with the good shape, with good proportions. Of course, the inside is very important, but looks, it's like a gift. When I try to give you the gift as I like buy it like this. But if I took this valuable thing that I buy it for you, but put it in a very good wrap, nice wrap, in good atmosphere and situation. Do you feel that will both of them inside core is the same, but you will feel the same appreciation from both sides? It's gonna be. It's not, of
No.
course. So don't put the shape and the beauty and proportions like it's just a superficial things. No, sometimes what's going outside, it's very important to deliver the value. The value sometimes it's really important. If if you are when you was a student in the school, and there's a teacher who's teaching you all the time a very important topics. But look, there is also another teacher. He's speaking a lot of valuable information, but a very nice and interesting and stories and what's happening during the lesson. Tell me, who's really at the end is better? Of course, both of them want to deliver the same morals and the rules and the informations and data, but one wants you really to not just to listen, to being that way and understand everything. I try to entering all the information throughout your mind, but the way that you like. So really the things, sometimes we are okay, we are dealing of the core, which is your health, everything related to your really health. But again, from outside, it's really important in order to live in a really good way and to be really, it affects really the psychology, and the psychology affect the organic parts in your body. So it's really valuable.
So we can say appearance becomes a kind of capital today.
Yes, of course. I told you, it's a huge investment even in your personality.
What makes someone attractive today?
Okay. As I told you before,
Looking
so Sarah, really, it's very simple question with like 2 or 3 words. But when you are thinking, what brings you attractive? Of course, after bypassing the basic things that related to your really the personality, your morals, your way of thinking, all this brings the patient. This is the value. We are not discussing what is outside
Yeah.
without the core. I don't want anyone to misleading or misunderstanding what I have say that I'm just dealing with, and it's very important just for me from outside. No, I'm always built up on the base of the core. So for you, for anyone from inside, after being good personality, good morals, good the very important base in yours. So what brings you more attractive? Course in shape in your face and body. As regarding my field, the balanced things, the balanced things. This is really important. The balanced and naturality. This is really very hard. If we try to be symmetrical, which a lot seeking that, we want this side to be exactly this side. This is always the main concept in anyone who comes to me, either in face or body. But let's say, firstly, the God who really create us, he create us in two unidentical halves. If you take like one vertical line, there's two halves in your face and in your body. It's not identical. A lot of things like this. So what we want really, firstly, to be strict for what is really natural. It's not identical at all, the two halves, but the problem if they are extremely different. This is when we go straight ahead to correct as much as we can as a human. But believe me, there is difference in anything in your body from right to left. Even your bone structure of your face is not identical. If you see the skull of anyone and put it on the screen, you will see big difference. So your base, your skull already different. How you want from outside to be identical? This is brings, Sarah, this brings a lot of clients when they are thinking in this way. I want to be identical. I goes for the doctor who is accepting this philosophy, which is already fake to be identical. They try, for example, we'll inject here, inject, trying to reach at the end balance. More or less, you become closer. It will not gonna be 100%, but maybe at the end we'll reach something very satisfactory for the patient, close, but at the end your looks artificial. Because again, it's a balance. I can brings you better, more or younger, whatever, but until which limits? Don't ask me for who's 60 to looks like 20. If we try to do that, of course, you will reach for how it gonna be fake. It will not be natural at all. We try to be more or less to become closer for who are watching. We try to know from 60 being 50, 40. This is to be, it's not a must from 60 to 20. You want, firstly, to look younger and healthier, more healthy, and putting things that when we are dealing with trying to make it, the wheel of the time becomes slower on your skin and your body. We try make everything with a balanced way. This is what's our real aim for any logic, scientific, plastic or cosmetology.
Do people want natural beauty or a perfect version?
As we mentioned already, it's more or less differ according from different countries, different cultures, from men or women.
I'm asking generally, actually.
Because some of them, as I mentioned already, who's seeking something fake, and others they are wants and they taught well and understand well the message that we are trying to deliver right now, in order to be. I want to be better, but really, please, doctor, being in a natural way. What's really brings us to feel myself himself really happy that this educational level of the clients and the patient is rising. It's not like before. All the time before, it was like, I want any trendy things. One clients do this, I want this, I want this, I want this. This was really from like 10 years, it was too much. It's decreasingly. And the awareness and the educational level of the clients is rising, as I mentioned. This brings me, okay, we're not reaching at the end the final stage of complete awareness because it's the life, but the message from the doctors like me and the TV programs that is very nice from you and others to deliver this information and data for the patients clearly. So we try just to add this for all one.
Do beauty standards change over time?
Okay, there is two things. Firstly, the standards that comes from book and science. It's like fixed scales, okay? So this is a standard. All of us as a doctors who is really professional in their works, they have to obey these standards in order for the safety of the client, the safety of doctor, the safety of the whole story. So we are going for the standards. It's a rules, cutting things, okay? But there is some standards with some modifications that happens by time and by the geographic maybe affection. Look, firstly, by time, do you think that the standards that fits nowadays, it's the same standard that of maybe to say who's Meryl Streep or whatever, who is the actresses that is from a long time ago, Elizabeth Taylor, whatever, it's the same proportions.
No.
When we are see their photo, we know that they are pretty, but it comes from another time at all. It's completely different. This is proven that the standards is different. But again, there is the base for the standard that we are all have to obey, the doctors and even the patients. When I'm telling you, no, I will not do this for you, it's against the standards. So, but again, the affection by time, the geographic. Do you think that the way that you like you to look like is the same who wants to look like in, for example, in US or in Gulf countries, on the Asian countries?
No.
No. So even the geographical level affect the standards. So again, base is the standards of the medicine, of the science. We build up above what is going on in order to be going with the time and be coopting with the time. So make some modification that the patient in this time really like, but without going apart from the real standards. This is the way that we want just to feel comfort, but in nothing against the rules, nothing against the actual standard. I'm trying to reach the meeting points, as I told you before. Oh,
People travel to different countries for surgery. So why is that?
okay, it's like anything, as I mentioned before. It's again, it's a medicine, it's science, and it's also industry. And of course, the awareness when it rise to mind of any clients and patients, if it's rise in his mind, so he tried to reach. I want at least after, of course, the God will, we want to try to reach at the end the things that really fits me to feel comfort. So each patient who is really intelligent trying to search. He search. If he find a real doctor with the concept that fits his mind and he wants really to go with this part and this direction, then he watch where is this doctor. If I find this doctor wherever he's in my country, he's a country beside me, in another continent even, but again, it's a very important. It's your face, it's your body. What's more important than that? So that's why, because of that awareness, this brings patients and clients traveling from one part to other. And to be honest, more, there's a small factor. This is the main factor, but there is a small factor, which I really don't like, about the financial issues. Sometimes you are traveling from one to other countries for seeking something cheaper. This is I don't like. Why? Because you are thinking about a really very important thing about money, and it's really you. It's your face and it's your body again. So you are trying to buy bag which is really expensive in order just to wear it, and you try to seek something cheaper in your health, in your body. Who will wear this bag if it affect you? If these bad things affect your face, really,
True.
hopefully not, of course, but if it's happened, you try. Firstly, there's a God and the will happen. But your role is to investigate well, search well. Don't put the priorities for financial issues, because if it's not suits you, don't do anything. It's your body. Don't go for a cheaper thing. You understand me? If you can really goes for whatever the doctors that you are trusting him with his certificates and professional level, and after searching, after getting convinced about his experience and whatever he done his work, after all of that, and you find the financial issues is there's an obstacle about that point, so you can cancel even until you find another one. You are accepting the full story, and the financial issues related to you, it's okay for you. You understand me? But again, it's a very important thing to think by medical first, everything, the logic manner, anything. Then after that, the financial issues. If it differ, then start a new phase, searching again, but not go first for financial, and then you do. And a lot of patients of mine, and a lot of very respectable doctor, because a lot of them over the globe, but there is a lot also who's not specialized even, or they are not good. A lot they are good, but a lot they don't have the least things about the vision of the beauty, sometimes related to his own. We are human. I'm a doctor, plastic surgeon, and he's a doctor, and he is a doctor, and he's a doctor. Some of them have the things of like skills from the God, the thinking even. As you know, a lot who's drawing, a lot who's playing football, all are the same? No, someone has something, he's talented, and he build up the science over it. So do whatever you want, but please, the final message from all parts, don't go and don't put the financial issues in the part of your decision, the first thing. Put it at the last, and then decide, and again try to search in order. Firstly, it's your health, it's your body. The decision comes from this point first. That's it.
Beauty has no borders, we can say.
Yes, trouble as of course, yeah.
I'd like to talk about your ionic liposculpture.
Yes. My hero.
Yes, your technique.
Yeah.
Is it just fat removal or body design?
Perfect. You shortened the answer very quickly. Thank you so much. Yes, it's not that. You know, all the patients, when it comes to my clinic, when it comes to their mind, to ask about how many fat, doctor, you will aspirate or you will suck. I told her, don't ask such questions. I can aspirate all your fats, but you know what's happened? We are destroying your body by this way. If you really want to ask the question, the real question, tell me how I will look like after you are designing my body. It's not like you are removing, just removing. I can put you on the machine of the liposuction, leave it you like 1 hour and come back without any fat. It's not like that way. We are dealing with, firstly, the design related, firstly, to the fat distribution. Sometimes you came to me thinking that you have too much fat. And at the end, when I see you, no, you don't have too much fat. The fat is not distributed in a very nice way or in a very nice manner. So we try to shift some from here to there. Of course, the body creature from the God is the perfect, but we can just add a small fine touches to elaborate or bring this real, very unique creature to be more attractive and you know, brings this real creature more for anybody to see how it looks like. So again, the ionic liposculpture differ from just conventional liposuction or even any liposculpture because we are dealing firstly with the design of the fat distribution and the way of how we aspirate in a smoother way. The second thing, which is really important, is the skin. Because just removing a fat without respect for the skin at all, this brings skin to drop. It's like deflation. You remove the fat, so the skin sagged, dropped. So what brings really ionic liposculpture for the top among the liposculptures, because it's really respecting the two main issues in the whole concept: the distribution of fat and the design with the smoother way, and respecting the skin with the contraction of, it's like 3D tightening of the skin through a technique which is not surgical. You will not find scars. So you will find just like small dots because we are doing, of course, I'm not telling you that the ionic liposculpture, it can fit all people. It's against the concept that we are already starting our episode with it. It's custom made, as I told you. So after analysis of the structure, as I mentioned, the first phase in the consultation, then if the liposculpture with the ionic way is the most suitable for her or him, so I will tell them at that end, okay, your skin is okay. It's like a mild or moderate case of the skin. It can fit with the ionic liposculpture. We can improve the quality of the skin, and of course, after bypass, the first part of the fat removal or distribution. So with both of them, with the ionic liposculpture, we can reach a nice result, natural, balanced one. It's not a drawing. We are not a statue. Okay, this is the real.
It's more about shaping the body than changing it, we can say.
Yes, perfectly. Let's go with that. Yes. Shortly, it's we're not changing, we are make you know, a fine touches to bring it more shiny.
You're like a designer.
Yes, more or less.
honestly.
In a medical way, with a medical background.
And your raincoats, is it like a
Different.
system for face?
You know all things. You don't let me say something. You all know everything. Fine. Look, for the rank codes, it's a concept again with the same I have delivered from the beginning of the episodes. How to look natural, how we are respecting our body. Now we are how respecting our face. What's going on by timing, the aging process. So what's RAM codes? All of you knows filler injection, which is a really respectable thing. The filler, what I'm already injecting for my clients, is composed from scientific terminology. It's not a trade name. The hyaluronic acid. The hyaluronic acid is a very nice natural substance or constituents that we are injecting to your face. You know, your face has its own hyaluronic acid already. This is brings your skin even to be well hydrated. It's really preserving the collagen and your skin and the cells. So If we are potentiate that effect with the injection of fillers, which is hyaluronic acid also, we give a value reel for your skin. Okay, this is the conventional filler. But what is RAM codes? RAM codes is my innovative way, and it's like two things. The first thing, how we are really, again, the analysis of the structure is called for us, the way of mine is the facial mapping with the codes and scales. So we try, when I'm teaching the doctors about their face, the analysis goes for the applied way of the anatomy of anyone's face through putting the mapping for him face and what is the codes of injection and scale the amount of each substance. This is the first thing in the RAM code. The second thing, what is the substance itself can be injected? It's already in the RAM codes that we want just to inject hyaluronic acid. Of course, it's very important to compensate what's going less by time, atrophied, your fat, the cells inside become less by aging or by time, or even by a huge weight loss at one time, you know. Of course, this is affect what's going on there and become less. So we want to compensate that with the hyaluronic acids. Okay, this is the first issue. But you know what's also in RAM codes? Not just hyaluronic acid. We'll add another substances, which, for example, like the calcium hydroxyapatite, which is called, stimulatory filler. The first hyaluronic acid called volumizing filler. It's a filler that gives volume. So we don't want to add volume. We want to compensate the volume loss that happens by aging or by timing or by weight loss. But another factor we want to be added for increase the value of results is the calcium hydroxyapatite, maybe one of the collagen stimulant. So you are, let's imagine with me, we try to make like a puzzle. We are correcting what's going on inside. Some parts become less, so we add here. Some parts become sagged. We want to compensate by other way. And this is the core. And the skin itself, you want to make like tightening of the skin through injection of substance that promote more collagen or brings the collagen to be more mature, maybe. So this brings the skin recoiled, take the new shape. So you are finally, with the RAM code, augment the result that comes from conventional filler in a more natural, balanced way. The same concept. So RAM codes is like the mirror shape of the Anaclab sculpture. The Anaclab sculpture, as you mentioned already, I'm asking me, how we looks better in the body from inside the core, proportional fat, and the skin to recoil with the techniques that relate a lot. I don't want to mention trade names for a lot of things, but again, from the core fat and the skin recoil, this is anaclab sculpture. Again, for the RAM codes, we are compensated what inside with the hyaluronic acid, with the mapping, with the scales and codes, and inject a substance for the skin, make it tighter, recoil. This is the main concept to conclude, and anybody can understand it in a really simple form.
That's wow, a beauty like architecture
Yes, of
nowadays.
course, with the medicine and science, of course.
In today's digital world, how does social media affect beauty?
You know, Sarah, you tell me two things at the same time. Social media is very important. I love social media. I love because, it brings the people become closer and you can understand a lot of things, the information, the data between your hands, whatever the things happen over the globe, it can be delivered once, can affect one. It's very good. But again, everything with a very major benefits, if it goes in a bad way, it brings a really horrible things and results. You know what's come from? I don't want anyone to take it from me as I don't like social media. I mentioned already. Social media is a very important technology. The AI, anything is very important. Anything that comes by time and there's a progress that happened, the science promotes something. Of course, it comes for facilitate the things and the life of the people. But again, in a wise way. Again, first of all, social media, it is between the hands of all the people over the globe. But what sometimes happens that brings me really, it's important to be delivered. The information and the data has to come all the time from who's supposed to be delivered that, the doctors. But you know what's happening with social media? Anyone can advise you. Anything you can, no, don't do this, don't do this. That's why a lot of clients come for me. I want this procedure. This comes from her. Her friend tell her this is good for her. Your friend, if a parent can consult you, make analysis for the situation and tell you, really, Sarah, of course, when we are dealing like this, it's funny. But let's imagine that this happened, and it's always happened. There is some doctors who are respecting their work. I claim that I want one of them, because anyone comes to me asking for certain things, I'm trying to back again for the structure analysis, then we'll decide. Don't ask me about things that you want to do for you. It's not good at all, okay? But again, a lot of patients, they have totally brainwashed because they are addict for social media. A lot of things has two edges, two angles. The angle that I really like, that you can take the good things from the social media, enrich your mind, take in consideration everything, but not let the social media leads you. Again, it's a science, it's a medicine. Go for doctors, the trusted doctor, the doctor that you are convinced with. Anything goes with them, then listen for them. After that, you can take decision, because there is some doctors, which is not too much, thanks God, because a lot of doctors very respectful and professional. But there, some doctors that, okay, you want something, I will do it for you. How it could be? She don't know. She have just imagination. The rule of you are the doctor. You have the message. It has to be delivered for the clients. Don't go with her. Maybe some trouble issues in her mind. Let's expect. Maybe she's depressed a little. Maybe she broke off. Maybe has issues. Whatever. So the role of you, doctor, is just goes whatever their mind is. How you respect your work at that time. You understand me? So this is something very important to be delivered right now in your episode, that the plastic surgery and cosmetology has a really important meeting points, and also has to be aligned all the time with the psychological issues of the client. You have, as you are a doctor, you can face them and you can understand. If she's already okay, and she are taking, and she's logic, and the way of thinking, all these things is okay for her, and try to deliver that. You can't imagine, it's like from 20 to 30% of my clients when came to my clinic, I told them, never ever, I will not do anything for you. Your treatment is very nice, very simple thing. Goes for psychologist, he will give you like one tablet, you will be okay. You are marvelous. You shape really in a very good thing. You have to thank God every morning, every minute. You have to thank God that you are okay. Please don't do this. Don't do that. A lot of patients, not less than 20, 30%. You know what's coming? Maybe like 20, 30% more. I told him, no, we'll do something very simple. You are magnifying the problem. At the end, the real percentage, what I face really in my clinic, it's like 30, 40% who's really comes already understanding their body, understanding what is really very close for what I will say. It's like 30 to 40%, but a lot comes with a brainwash, with high expectations, which is already unrealistic, and of course it's not mentioned in any books or any science and anything. So I try to know, this is the not good things or the bad things in social media. I try, to clean all what's happened to their mind. This is brainwash. This is the not valuable data at all. The data is not real. I try to remove it at all and try to deliver the basic information and the science and the medicine to their, hopefully that they can understand me and to feel that in order really to do something good. In order, you are treating her mind first, then if it's okay for her, you try to improve her body or her face or care about her. That's
Also, filters
oh
create unrealistic expectations,
yes,
right?
yes. You goes really like darts for the target. Yes, a lot came to my clinic. Look, doctor, I want to be like this filter. Two major requests. I want to be like this filter. I want to be like this celebrity. I want to be like Sarah. I want to have this filter. A lot. Sarah is and she's an idol for beauty, and she's already queen. We all know. You are already queen. Yes.
Thank you.
Yes, you are a queen of pretty. no, everyone in your country know this, of course. But again, you are this because you are Sarah. If your things, your faces, I will take this nice nose, I'll put it on her. I will take this lips, it will not fit her. It will not be nice. It will not be even pretty. She has, if you take any pieces, is nice, but all of us are not okay. They are not pretty. Some, it doesn't face you before that you see someone, you don't feel that is pretty, but look, his eyes or her eyes is okay, and hers, but why she's not looks pretty?
Harmony of
Harmony. Thank you so much.
As a final question.
Oh, really? The time is past. How is that? Okay.
If beauty is a form of power today,
Mm.
who controls that power, do you think?
Okay, unfortunately, social media has a major role. I'm not telling you that it's the only power, but the good and bad things that this power is increasingly all the time. The virtual things, because of distances, because the people become more busy, they want to feel relaxed while they are doing something. So anything that's in the direction of technology for whatever, the AI, anything that social media, anything that's related to the virtual life, it comes to mind of anyone that is better. So social media has a great impact and it's really has a power. What I want really at the end of your respectable really program to be delivered for all of you, even you and who is sitting beside the cameras, anyone will hear me or watch me in this program, please put in your mind these words. Again, the science and the medicine is between our hands, okay? Goes for a lot of doctors that they are really respectable, understand the real information and the data. The doctors you are chosen is already good one, and he is professional with the good sense of humor, goes with him whatever he wants after understanding and get convinced, but not please push any doctors, because there are doctors like me who can stand whatever you say, and you tell me, I will tell you no, no, I will not do. This is not okay for you. This is not, even when you are paying for me like 100 million, 100 billion. I'm not joking. It's real for me. I will not break the rules. But sometimes the doctor, some of them can, if you want it and insisting to do something, he will obey you. But don't do this. If we say from the first time something, try to be in the same direction. If we try just to make some modification a little bit, it's okay. But don't go against something. No, doctor, I don't want this, I want this. If he is accepting something, he didn't say it at the beginning, it's not logic. It's not logic that you are, he is accepting because his personality can accept something wrong. It's not that he becoming convinced. If he is convinced, he will start with this offer. If you are shifting the mind of the doctor, believe me, you are going far. You are not getting closer. If you understand me, please, this is the final, really try to understand, try to help yourself, try to search too much, trusting your mind, going for doctor, trust the doctor that you are already searching and you are trusting him, then don't make a major shift for the mainstream of the doctors that they are, when they are make analysis for your pattern, they say it from the first time, this is okay for you. Go with this. Don't make a major shift. Thanks so much.
Dear doctor, thank you for this great conversation.
Thank you so much. I'm really happy being among all of you. Thank all of you for all the team. Please, thank you. Send them.
I'm really happy.
Thank you so much.
Today we talk about beauty, but also about confidence, perception, and choices. Because economy is not only about numbers, it's about how people shape themselves and their future. See you next time.